we doing today, April?
Doing all right.
Doing all right. It's good seeing you again. So how are we feeling? Tell me how things have been going.
Let's see. I've been laying in this bed, paying thousands of dollars for garbage food. Nurses are incompetent, and now you're gonna come in here and make me move.
Yeah, it's definitely a tough time you're going through. Can you tell me a little more? I feel like there's a little more going on here than just the food and being in bed. You want to expound on that a little bit?
I'm just in constant pain, not healing. I'm not going to. People are just not taking care of me. Never see my wife. The food is disgusting. Have you ever had hospital food? It's horrible. Probably paid $3,000 for my dinner last night. Could hardly eat 2 bites of it.
Yeah, it's really difficult. But I mean, as for getting better, we're all working, and I've been very specifically trained to get you up and moving, and to get you out of here as fast as we can. And that's specifically why they have physical therapists here in the hospital, is so that I can get you more stable and get you home with your family as soon as we can. And as for pain, I can definitely talk to some of the nurses, see what we're doing about it, see if we can increase some medication.
All right.
How about your wife? Has she been coming after work at all?
I mean, she's been trying to, but she's still got to work, and she's still got to take care of things at home.
Yeah.
See her as much as she can, but she's busy, you know. Hospital 45 minutes away from her house.
Yeah.
Just don't have that much time, you know.
Oh yeah, absolutely. That's really, really challenging. I'm really sorry about that, but like I said, we've got some stuff planned for you, and we can definitely get you out of here. You stated some concerns with moving around, with me being here. Tell me about that. How are you feeling about treatment today?
I just don't really see a point. I think it's kind of a waste of time. I think that, I mean, you know, I can move, and it's fine, and I don't see how it could possibly get better by making me walk around and do whatever it is that you're here to do.
Yeah, absolutely. Well, I definitely understand that point, and it's not even an invalid point. I totally see your side from it. A big thing about physical therapy is that movement is good for the entire body. And the more that we get you moving, the more strength you're going to have in that leg, the more strength you'll get in your arms, the more your heart will become more fit again. And so the biggest thing is what we need to do is make sure that we can get your body back to the point where it's ready to be independent, not have anybody helping you again. And so that's why I'm here, and what we're specifically going to work on are things that will be specific to your life. And so if you want to, you know, if we can talk right now, we can come up with a couple things that you're concerned about, that you want to get back to. I know we've mentioned golfing and just getting home, but if there's anything else you're interested in or concerned about, I can make our treatment fit towards what you want. So let's try and think of some ways of how we can make it meaningful for you.
I just really don't see a point, honestly. You know, I'm not trying to be rude. I just feel like how could I golf after this, you know? It's like I can hardly, you know, my hands are tingling all the time, and it's like, how am I supposed to grip a golf club, you know? It's just kind of, I just don't really see a point. I feel like we're just going to put me through some torture some more, just like it has been for the past several days, and then I'm going to go home and I'm going to sit on the couch and do nothing there.
Mm-hmm. Yeah, and it's very easy to feel that way. I completely understand it. Have you ever heard the term how to eat an elephant?
One bite at a time.
Exactly. So I understand, and right now, yeah, you wouldn't be able to hold a golf club. But, you know, we're going to take on the little things. For instance, I believe you have a catheter in right now. Mm-hmm. So maybe let's not worry about walking a whole golf course or, you know, going up the stairs at home. Maybe let's focus on getting you to the bathroom. Because as soon as we can get you stable enough to go to the bathroom by yourself, we can take the catheter out. You know, so it's little things. Let's work on those, and then we can build up to the bigger things. Does that sound okay with you?
I guess we can try it.
And, you know, I mean, the biggest thing is that, you know, we're here for you. You know, I know that it might sound cliche, but I mean, the reason that that we're people in the hospital are here. There's other places we could be working. So the reason we're here is because we care about people, and we want to make sure that we can get you from this point where you're feeling down to back to normal life. And if we couldn't do that for people, people wouldn't be paying us to do it. So I mean, take a little comfort in that we're here to help you, and that we're going to work tirelessly until we get you where you want. So let's not worry about the big things. Let's focus on little things, one step at a time. So so tell me about, I think a good goal for us would be work on getting you to the bathroom by yourself. How are you feeling about that?
That'd be kind of nice.
Yeah.
Tired of having these women help me.
Yeah.
I think they're being paid too much, honestly.
Yeah. Is there something going on with the nursing staff that I should know about?
I just, over time, as I've been thinking about it, the surgeon, he did a good job, and I'm just really thinking that this stroke was probably because of them. I don't think they're doing their job right, and now I get to suffer for the rest of my life.
I think it's one of those situations where I don't think even if we could find whose fault it was, it wouldn't change it. This is the situation we're in, and so we need to just move forward from here. Just keep moving. I mean, and it's really easy to get bogged down on things like that, on whose fault it is and why this happened. But at this point, if you look at the big picture, it doesn't matter. If we knew who it was, and let's say we fired the person, would that help you right now? Would you be feeling any different?
Maybe a little better.
Yeah. Yep. And so I think, I understand. It's a very difficult situation to be in, but we can't focus on the things that we can't change. So let's focus on what we can fix.
Right.
That sounding okay?
Yeah, I guess so.
That sound like I'm full of it?
A little bit. A shot, I guess.
As long as it's a half full, it's a half empty because I'm full of it.
Okay.
So what do you think? I think so. Let me give you my plan for what I wanted to do today. I wanted to kind of look over a couple of things that we measured, talking about chest pain, how you're breathing, take your vitals, see if we're getting any progress there.
Okay.
I'm pretty sure we have, but that way we can measure it and then record it. And then I was thinking about maybe working on moving around in the bed a little bit, just to kind of teach you, making sure we're staying in the box or staying in the barrel. That way we're not hurting your chest at all when we're moving, but we can teach you a good way to move. And then I also want to get you up and moving if we can. What are your thoughts on that?
I'll give it a shot.
Give it a shot. We'll have lots of fun.
Sounds like it.
All right. Well, the first thing is I would take a look at vitals. Patient would still be hooked up. So documenter you can choose. I'm saying that we're going down a little bit. So your vitals are looking really well, and you're right on course with coming back down from that surgery. So that's what we want to see. And so that is a good sign for you. I mean, it's only been a couple days since a major surgery, so we're seeing improvement already. Is a good thing. So let's talk a little bit about how you're feeling. Last time we talked about you were a little bit short of breath, and you told me it was kind of you were mildly noticing that you felt like you were having a hard time breathing. How are you feeling right now? Would you say it's mild? Would you say it's a little more severe? Would you say it's a little less mild? Or a little less moderate? What would you describe it as?
Well, I don't know. I feel like I can breathe a little bit more normally, but the pain is just constant. I just breathe even though it hurts. I was trying to avoid the pain before, and now it's just kind of, I just expect it. I don't really feel out of breath, but all I do is lay in this bed all day long every day, so kind of hard to be out of breath here.
Yeah, I get that, and we'll get you moving. That's why I'm here. So it might not be fun in the moment, but getting you out of bed is why I'm paid here. So we'll get you out of here. Tell me a little bit more about breathing there. You're saying it's painful. Is that still just on the incision there?
Mm-hmm.
Okay. And you mind if I take a look at it, just make sure it's still healing like it should? Okay. Take a look. I won't go as low so you don't roast me again. Have you heard? All right. Have you heard anything from your documentation? Is it still looking good, or do you not know?
They didn't say anything.
Okay. So we'll just say it's looking good still. So it's healing up. Obviously, it was a pretty major thing, and that's a big reason why it's causing pain. But that pain will stop. It'll come down. So that's a good thing to focus on as well. That, just a little bit longer. How about the chest pain not related to the incision? Last time you said it was about a 7 out of 10, or fairly severe. Would you say it's mild, moderate, severe, or like excruciating right
Um, I'd say it's still severe. It's kind of just, it's like that gnawing pain that's just constant. It's been here since the surgery. The pain is just constant. It's like driving me insane. It's messing with my head. I honestly couldn't tell you if it's gotten better. It might have gotten a little less painful in the past 2 days, but it hasn't gone away at all. I haven't had any breaks from it. There's like no amount of medication that they'll let me have to just be able to, take a break from the pain.
now? And is that on the incision, or is that? Okay.
Yeah, it's just on the incision. It feels like the rest of my lungs feel okay, I think.
Yeah.
I haven't, as far as I can tell, there's no pain just from breathing. It's just
Right.
from the incision.
Yeah. That's really tough. I'm really sorry to hear that you're going through it, but we'll work through it together. We'll get you through it. So I did check your legs a little bit just to see if there was any, the little bumps, see how long they went away. Do you mind if I try that one more time on you? Okay. I'll push down here. Good. Derek will say it went from a 2 to a 1, so there's an indent, but it went away pretty quick. Just to kind of fill you in, so the angina scale is still 3, like last time, and I'd say dyspnea probably still 2. Doesn't sound like we've decreased enough to make me feel comfortable saying a 1, just for you. Okay. So that's most of what I wanted to do. I want to listen to your heart again, to listen to those sounds, see how we're doing. You okay with that?
Yep.
Okay. And we'll be careful around that incision of yours. Okay. Mind if I go under your shirt just a tad bit? Are you okay? Just moving some of that tissue out of the way for me. Our patient will already have this. Sounding pretty good. You mind if I listen to your lungs again? So we're kind of just go box around. Sound good? Okay, and we'll avoid that incision for you. That's as much as you can before you got pain. What?
Great job. Push your thumbs up.
You don't have it. You're male.
That's right.
Will it out?
Maybe I do.
That's not something I have to worry about. Good. Sounding about the same. A little bit less wheezing, which is good. Coming back around. Tell me more about how your right arm and leg are feeling today.
I've gotten a little bit better about using them to kind of move around and sit up for my meals and stuff. They're kind of, I still can't feel, it's not like before I came into the hospital, but it has gotten better the past few days. I've definitely noticed, I have kind of a little bit of grip now.
Good.
So that's kind of nice, I don't really feel comfortable holding my drink, but, I can pick it up if I need to. There's a little bit of grip there.
It's coming back pretty quick. That's really good.
I can even put a little bit of weight on my foot, actually, when the nurses let me walk over to the door, and I just felt like a little bit of weight on there.
I know it's hard to feel lucky in the situation you're in, but there's a lot of people who never get it back. So it's something to be grateful for in a whole lot of crap. It's good. So I think we should get you moving on it a little bit. I'm happy to hear that. So first thing we'll do is we're just going to do something called bed mobility, and that's just going to be teaching you how to move in the bed with the situation, especially with the sternal precautions we need to be aware of. It's kind of like having chicken wings. So what we're going to do is, and we're not going to do it yet, but the main basis of what we're focusing on is making sure that when we're moving, you have the arms tucked in here, and we're kind of doing this kind of a thing, right? Not arms way out, moving, pushing. It's just when we need to move in bed, it's kind of, you're just doing a little dance. So we'll get to that. First of all, I just want to see how you handle some of just like a little more pretty mild exercise. So I just want you to, with your left leg first, just scoot your heel up, far up as you can, just bending that knee, good, and back out. Just kind of reminding, hey, we're meant to move, keep going, and do that about 10 times. How are you feeling? How's the chest pain, other than the incision, feeling right now? Feels fine, not any worse, it's about the same. Now, let's see how this leg does. Good. A little more challenging on that side. That's really good that it's working though. That's incredible for you. Good. How you feeling?
I mean, it's more work than I've been doing.
Yeah.
I'm still feeling fine.
And how does your chest feel? Feeling okay? Leg feels just a little fatigued? Well, let me, if you don't mind, you remember how we did the testing where I tapped a couple different areas on you? Do you mind if I try that again to see how we're feeling?
Yeah.
Okay, so go ahead. Go ahead and close the eyes for me. Is this same or different?
A little bit different.
A little bit different. How compared to last time? What did you say?
They're pretty similar this
Pretty
time.
similar.
Yeah.
Oh, it's feeling pretty like your legs are feeling pretty similar.
Yeah, they're feeling pretty similar.
Good.
Yeah, sorry, my legs are.
That's totally fine. And same or different?
Just a little different.
Different. There.
Just a little different.
There. I would take off the patient socks and not be doing it over pants, obviously. There.
Just a little different again.
And under the knee. Do you mind if I do it on your arms as well? I'm pretty happy with how much we're feeling right now, so I just want to take that momentum and check it out for you. Is that okay?
Mm-hmm.
Okay. Close those eyes. Same or different?
Just a little bit different again.
Okay. Same or different? Same or different? Same or different? Same or different? Okay, and then just on the ends, or the, let's see, I already did. So on there, same or different? And here. Okay. So Derek, that's kind of quiet. All of it is, it feels better than it was previously. She feels more sensation. However, it is still different. Good to report.
Oh, I can't do that with my arms.
Ridiculous. All right.
Sorry.
So I'm glad your vitals were fine while we were doing the little leg activity. That for me is just kind of a test to see how you're going to handle a little more vigorous stuff. Okay. So the next thing I want to try out is I want to try some, it's called, like I said, bed mobility, where we're going to focus on 4 things. I want to scoot this way, I want to scoot that way. And we want to kind of roll on your side this way, roll on your side the other way. Important to remember to stay in that barrel, and also we cannot go on your stomach no matter what. So if we get you here, we can't go all the way down, because that, again, for your chest, I'm sure you don't even want to, like not even remotely. Yeah, I'm sure you were considering it as an option, but just so we know. It'll work a little better. We can do the scoots with the pillows, but after that, it might be a little easier to do rolling side to side without them. But if you want to leave them, that's fine too. We'll make it work.
Doesn't make a difference.
Good. So the first thing, let's just work on scooting. So it's going to be, think of your upper body and your lower body. Mm-hmm. So the first thing we want to do is kind of get your hands here and then press with your elbows into the table. Yep, good. And then kind of get the hips off and then just go, yeah, good. Either way is fine. That's fine. Perfect. Just like that. Good. Now let's go the other way. Good. Natural, right off the bat. Could use your legs a little bit more, push the heels in, and then get your backside off the table, and it's going to help everything move.
Just to do my upper body.
Well, we were kind of focusing on that position, but you were a little more of a natural, so a lot of that, yes. A lot of times we have to do a little more work, but it's coming pretty easy for you. So let's try one more time, scooting that way, just with the upper body. We're kind of over there, but just scooch a little more that way. Good. And now get those legs. Good. Now come to me. And again, staying in that barrel, looking really safe. Good. Good. How's that feeling?
Pretty good.
Pretty good. How would you say chest pain right now, other than the incision?
Mild for now.
It's mild. Before it was severe. So are you saying it's like mild change?
So sorry. Before, when I say it was severe, I meant that the incision was severe pain. As far as breathing, to be honest, I haven't really gotten a lot of cues on it. I don't think so.
That's okay.
So I'd say just kind of mild pain from breathing.
Mild pain for breathing. Okay, good. We'll change that. And then, how about, that's okay. There's two different things. So the breathing, you were saying you're having mild pain with, and then shortness of breath, you said was about the same. Is that right?
I think it's gotten better since last time. You know, I'm able to take a little bit more of a breath in.
So it's just kind of like sometimes you notice, but not that often.
Yeah.
Okay. And then, so you just, before I think you told me you just had like kind of resting chest pain, kind of like felt kind of over in this area that wasn't the incision, kind of felt like your heart attack before you had it. You still have that?
Yeah.
And you'd say that's severe, moderate, mild?
Probably mild.
Mild? Okay. So Derek, another thing for you. So dyspnea scale, we're at a 1, or I think 1+ for dyspnea. And then angina is a 1 also. So we've improved both of those spots. Sorry, I told you previous numbers. Blame April.
Hey, I'm just the actor here.
Just kidding. Good. Well, that's really good. I'm glad. So it sounds like the other areas are kind of coming down. It's just that incision that's hurting pretty bad. That's good. And that just comes with time. I know it's really, really crappy answer that you just have to wait, but a couple more days, you'll be feeling pretty different. And your vitals looking good from how we're scooting. So I think that's pretty good. Let's focus on the roll now. We can just leave the pillows. I think honestly it'll probably be easier. So roll's a little trickier.
Okay. So
we're gonna roll this way first. And so a lot of what we need to focus on is pushing with this arm and getting this arm out of the way. So you're kind of pushing here and tucking, right? So push and tuck. Good. And then, yeah, kind of like that. And then, yeah. Good. And make sure we're staying in the barrel. Good. And now come on back for me. Nice and slow. Good. That's perfect. You did the right thing. I didn't even have to tell you about the legs. Bent that guy up and moved it. So this is going to be a little trickier coming towards me because that's going to be the side that's a little weaker right now.
Yeah.
We'll work on it and we'll see how much strength we can get, but we need to be able to go both sides because, and I mean, I guess for laying down it's okay, but especially when we're moving like from the bed to the chair, we're going to have to practice both directions, mainly because, I mean, think about a toilet, think about eating at home, like very, very rarely can somebody just get up one direction.
Okay.
So before we try that, I'll have you do your scooch that we just practiced and go that way for me a little bit so we have a little room to roll. Good. Like a pro. Make sure we're staying in there. Good. So now, same thing, but the arms switch jobs. So we want to tuck this guy out of the way, want to push with this guy as much as you can. Good. Good. That's awesome. Great job. Okay, now go back.
Well, that's a lot easier.
Yeah. Gravity's your friend there. Good. And so Derek, I'm not really concerned. As far as interventions go, I would say we don't really need to practice that anymore. The patient's doing really well. So I would just say one set of, I don't know, I guess we did scoots a couple times. So one set of, let's say 3 reps each, just to make sure we've got it down. I won't show it so you don't have to take all day, but we do 3 for each. Okay. So now I know that you were not feeling better. You're not feeling super great about it. I think if we get you up and moving, it would help you feel better. And again, the faster we get you moving, the faster we can get you back to normal life. Are you okay with getting out of bed?
Give it a shot.
Give it a shot? That's good. Good. So the first thing I want to do is well, you tell me. We can do 2 things. We can practice standing up and sitting down, or, going from sitting to getting out of bed, kind of changes directions. Or we can get up and we can walk to the bathroom and back. Which sounds better to you?
Probably walk into the
Bathroom. Get that thing out of you?
Yes.
I feel you. Okay. So I'll lower the bed, get the patient safe. So the first thing I need to do before we get you up is I'm going to have you swing your legs over the table and have you sitting up, and I need to put that belt back on you. That way we can get you moving. If something were to happen, we're safe. Okay. So we'll have you do your fancy scooch we taught you. Make sure even when we're doing this, keeping those arms in the barrel. So scooch towards me. Good. And again, as we're leaning up, push those arms back and then kind of sit up, and I'll help you as much as you need, but you seem like you're doing okay. Good. Good. How you feeling?
Oh, I'm alright.
And we'll just hang out here for a minute. I have my handy dandy belt again, not putting it on because of this is a baby. So we have your imaginary gait belt. So we're just gonna hang out here for a minute, make sure you're not feeling lightheaded, dizzy, any of those things. We're gonna take
them in real life.
We'll hang out if you're dizzy in real life.
Pregnancy is weird. Okay,
Yes,
it's
no,
fine.
and again, Derek, I don't know if I mentioned this. We would lower, I guess not just Derek, whoever's watching, we would lower the table so the patient's safe. Their feet are actually on the ground. They're in a good position right now.
Yeah, not very safe right now.
Very unsafe.
Alright.
Okay, how you feeling? Ready to stand up for a minute? So we'll do the same thing where we stand you up and we'll just stand for a second, make sure we're not pushing too fast. Remember, hang on just 1 second. So make sure we get heels under knees and we stand up firm like that so you got a good way to push, okay? And I'm not gonna help you. Do as much as you can. Good. And we have a walker here.
Okay.
Just for balance. Okay, just hang out with me for a minute.
Okay.
And again, Derek, this is just this is contact guard right now. Good. All right, let's kind of do a little bit of wiggling. Come towards me. Put a little bit of weight. Just sorry, the weight shifts we did last time. So here, there, here, there. Swaying like a tree.
Like a
Yep. How you feeling?
Pretty good.
Good. All right. Should we cruise for a bit?
Alright.
All right. So a reminder about those sternal precautions means that when we're walking, we have the walker. You can be moving it, but don't put weight through it. If you start losing balance, I've got you. Don't worry. We'll do a little. Take a knee, and you'll just sit right on my knee. So don't worry about that. So let's go for the walk. Let's see if we can get to that bathroom. Good. How are we feeling? Dizziness, chest pain, anything like that?
No.
Good.
And my head hurts now. Yelling in my ear.
What? Alright.
Okay.
Yeah.
Okay.
Okay, let's come back. Good. How you feeling?
Pretty good.
Good. So let's stand for a minute. So we made it to the bathroom.
Sure
So
did.
we'll talk to the nurses a bit. Maybe not today, but because we're making it, we'll get that tube out of your body.
Okay.
Well, one of the many that you have, but one less tube. So tell me here, the nurses told me you've been in your chair for quite a bit, but you needed a break. Where are you wanting to be now?
I could probably go back to my chair.
Chair? Okay. And let's do a little bit of practicing. We'll do some sitting up and sitting down, standing up and sitting down, whatever. Okay, good. Good. Here, let me come follow you. You're going to have a cord. I have a little box of them, so I'll have you around here. Okay. So, good. Just walking backwards till we feel the chair on the back of your legs. Good. And now just down you go. Good. Like a pro. Nicely done. And we'll take a little rest for a minute. Tell me how you're feeling.
Done fine. A little bit more pressure in my chest.
Yeah.
That's about it.
Tell me about the pressure in your chest a little more. So, like, is it the incision hurt?
Yeah, just a little bit on the incision, and it's just the breathing. I haven't done a lot of movement in the past few days.
So we talked about like the shortness of breath before. It's just sort of like feeling like you can't get air in enough. Are you feeling any of that right now? Any more so than you were before?
No, it's definitely less than the other day.
Cool. And it's not less, or it's the same as when we were talking earlier when you were in bed.
I mean, I feel like I want the oxygen a little bit more, but I feel like my breathing has changed.
Okay, good. So dyspnea is still 1. How about chest pain not related to the incision?
A little bit more.
A little more, like mild, or would you say it's like you're moderately noticeable now, or is it? Okay. Yeah. So angina moved up to a 2 with exercise. That's to be expected. No worries there. Good. I'm happy with how things are looking. You're doing great. For this point where you're at, like you're right on course. So I mean, don't be discouraged. We can do this. Some things that concern me you brought up if, I mentioned last time that we could get you in contact with anybody that if you want to talk to someone who's professionally trained about this. Do you have any interest in that?
I think I'm still okay.
Yeah.
Dealing with life,
That's totally fine, and I don't think any of this is unusual. This is a really typical change for you and your family, but you guys are handling it well, and I'm sure you've been through things before, and you'll get through that just like this, like you got through those. We'll keep pressing forward, keep moving on. So last thing I want to practice, now that we rested a little bit, is I just want to help you stand up, sit down, stand up and sit down. You're doing it pretty well, but we're just going to practice a little more, just to make sure that we're going to the point where you can do this safely on your own, okay? So tell me some of the rules. Do you remember what are the things you need to do when we're standing up? Let's start with arms. What can you do with your arms?
Keep them close to me.
Yep. Can we put weight through that walker as you're standing up?
Not supposed to.
Correct. What about pushing down off the chair?
Probably not. Okay.
Correct. All right. So that means when we're standing up, we're using our legs mostly, yeah? So where do we want our legs when we're standing up? Sticking way out?
No, close under my knees.
Yep, heels under the knees, so you're in a good spot, you're ready to stand up. Patient still has the gate belt on. Obviously, we've been watching out for tubes and wires as much as we can, even though they're invisible. So we're going to do this. What do you think? I think we should shoot for about 3 to 5. How do you feel about that? Let's do it. Okay, and we'll be talking every time you come back. We'll sit for a second and you tell me how you're feeling.
Alright.
And I'll crack the whip.
Alright.
Make you do another one.
Great.
Okay. All right. So we'll have you. I'm here. We got the belt on you. I'm just here for safety. I'm not going to help you at all unless you need me. Okay? Let's go ahead and stand up. Good. Weight through those arms. Good. Yeah, I do want you to sit back down. We're not walking. We're just sitting back down in the chair.
Okay.
Yeah.
Do what you don't have to say it's so sassy.
Absolutely. Whoosh. Okay. So one more. How are we feeling?
Feeling fine still.
Good. Make sure we're getting equal distribution of weight, left and right feet. Do another one. Good.
Definitely harder to put it in my right side.
Yeah, and that's completely what we would expect right now, but the fact that you can is incredible. So awesome. There's 4. How are we feeling?
Feeling okay.
Feeling okay? You keep doing so good, I'm gonna make you do more.
Oh.
That's what I thought. Come on up. There's 5.
All right.
How we doing? We got one more in you?
All right. Yeah.
All right. Let's do 6. Good. And back down for me. And talk to me. How are you feeling? How's your chest?
About the same, I'd say.
About the same.
Feeling a little bit more tired, but that's about it.
Good. How about your breathing? You feeling like you're getting enough oxygen right now?
Yeah, probably, yeah.
Okay. Vitals are looking good. They're adjusting normally as we would expect. What do you think? You got one more set in you? How about a set of 5? Can you do it 5 more times in a minute?
I don't really want to.
No, I want to. But the more we do this, the quicker we'll get out of here. I won't make you guys watch it.
I was gonna say, can I just go really fast for video's sake?
Do jump squats. No,
yeah.
so
that'd be impressive for this guy. Okay.
Yeah. So I think we're in great situation. So there's 2 different areas we can send you after we're done here in the acute care facility. So in the right now you're in the intensive care unit, the ICU.
Mm-hmm.
We can send you to a skilled nursing facility, which is an area that basically you're just going to stay there. They have physical therapists there that can help you until you're ready to handle those stairs on your own. Or we can send you to inpatient rehabilitation, which is still going to be at the hospital.
Mm-hmm.
There's pros and cons to both. The thing with inpatient rehabilitation is that there's people specifically trained to teach you to come back from a stroke. You'll get more practice and more treatment time.
Is that the one here in the hospital?
Uh-huh. So you'd still be here. And I want you to be part of this. In my opinion, you will receive more intense and better focused treatment here than you would in a skilled nursing facility. You'll still get treatment there. But these people are specifically trained to deal with stroke patients. So if it was up to me alone, I would say inpatient rehab. But what are your thoughts on it?
I don't want to be in this place anymore. And
Yeah.
honestly, I really want to go home.
Yeah.
I feel like, you know, I'm just sick of being here. I don't want to go to another place either. I just want to be in my house. I want to go back to my bed. I want to use my bathroom. I want to see my TV. I'm just sick of it, you know.
I completely understand that, and we're not too far out. This isn't going to be months, kind of a deal. So the issue here is just because your wife's not going to be there with you, and you have the stairs out front of your house. I don't feel good about sending you there right now. I don't feel like we're at the point where we could get upstairs by yourself. But if you want, you know, if you're wanting out of the hospital more so, and you prefer to be in a skilled nursing facility, there's a lot of good ones. We can get you in one, and we could try to find one closer to your home so your wife could come and see you more. Or we can keep you in here. At this point, to be able to do inpatient rehabilitation, you need to be able to tolerate about 3 hours of treatment a day. And that's not just going to be from physical therapists. That's going to be physical therapists, speech language pathologists, and occupational therapists who will help you with more like day-to-day things, like, you know, using your hand to, you know, tie your shoes, flip an egg or an omelet or whatever. Whereas I do more big, you know, big movements, walking back and forth. But again, I want you to feel included in this. So we don't have to make a decision today, but think on it, and let's, you know, I think at this point, going home right out of the hospital is just, it's a little too dangerous. I mean, it stinks, but say you fell going up the stairs, and, you know, you fell on, you know, that put a lot of pressure on that incision, and we'd be right back at square one. So I think looking forward for the long term, the best decision is to make sure that we get you healed up first before we send you home. Is that all right? Tolerable?
Yeah.
I understand. Yeah, so think on it. We'll talk next time I see you, and we can kind of make a decision whether you'd like to stay here or go to a different place maybe. Sound good?
Sounds good.
Any questions for me?
I don't think so.
Hey, it was good seeing you. Other hand. Give me your other hand.
Ow.
Oh, I didn't shake. You shook it like that.
No, you did that.
Alrighty. Well, we'll see you next time.
Okay. And see.